going to talk about the health needs of commercial sex workers. Sex work is highly stratified. It includes escorts, those who work within an organization like a brothel or a massage parlor, those with pimps, and street prostitutes. Street prostitutes are the class of sex worker that's been the subject of the most research, so the majority of the information we have is on them, and it may or may not apply well to other classes of prostitution. Nearly 60% of sex workers are trans, and the vast majority of those identify as female. Sex workers tend to have less education and are less likely to be married than their peers. In Raleigh specifically, the average age for street prostitutes is 34. 2/3 are African American and 1/3 are Caucasian. Sex workers tend to live in extreme poverty. A quarter report going to bed hungry 4 days a week or more because they don't have enough to eat, and more than half are either currently or recently without a home. All sex workers are at risk for work-related violence, but the risk among street prostitutes is the highest. They have the highest homicide rate of any profession, and their assailants are most often their clients. Because of the social exclusion they face, they're particularly targeted by serial killers. They also experience high rates of sexual violence at the hands of law enforcement, pimps, and their clients. They're also at risk of sexually motivated kidnapping by clients because, in the words of one sex worker, nobody would notice or care. Naturally, this population faces severe trauma as a part of their work. Many of them have also experienced severe trauma before entering the sex industry. Childhood sexual abuse is especially common. This population is nearly twice as likely to have been removed from their home as a child as the general population. Unsurprisingly, sex workers experience high rates of mental illness. They face post-traumatic stress disorder, depression, and suicide at far higher rates than the general population. They also report a weaker sense of community belonging and weaker family connections. Related to mental health, rates of drug use are very high among this population, especially among street prostitutes. 70% report injecting drugs in the last 3 months, and 86% say that feeding their habit is the primary reason they work in the sex trade. Most have seen someone overdose, which is a traumatic event in itself, and nearly a third have themselves overdosed in the past 6 months. HIV is incredibly common among sex workers. Transgender women, who make up the majority of sex workers, are the group most likely to be infected, and the risk of HIV infection is made much worse by IV drug use and the sharing of dirty needles. Despite the need, there are few resources available to addicts looking for help. A 30-day detox costs about $24,000, and during that time, the patient is unable to work. Without significant and expensive support following detox, relapse rates are very high. Even if you can afford it, beds are full, and wait times can be up to 1.5 years in some states. This is a grim picture, but there are some small measures that can be taken to reduce drug-related harm. Some states offer safe injection sites where users can inject under medical supervision, and needle exchange programs are becoming increasingly common. Additionally, the use of fentanyl test strips to prevent overdose has shown promise in some studies. Sex workers deal with specific health concerns during pregnancy. Their higher risk of sexually transmitted infections increases their risk of adverse outcomes for both mother and child. Drug use during pregnancy also leads to severe pre- and postnatal issues, including stillbirth, neonatal abstinence syndrome, premature birth, and SIDS. In addition, the violence that sex workers face will obviously cause harm to a pregnant woman and developing fetus. The most common barriers sex workers face in parenting their children are financial instability, intimate partner violence, a lack of support from extended family, and stigma. A significant number also avoid accessing services because they worry their kids will be taken away by DCFS. The stigma associated with sex work leads to weakened social ties, which in turn makes it harder for sex workers to raise children. Sex workers are nearly 4 times as likely to have a child removed from their care. Transgender women have specific healthcare needs related to their transition. Trans women of any profession have an increased risk of HIV, and sex work increases that risk further. The discrimination and stigma they deal with is a major barrier to their willingness to seek health care. Many transgender female sex workers report taking hormones unsupervised by a physician. This is an ad I found for a product that you can buy on Amazon that is not evaluated by the FDA. And a significant number of transgender female sex workers take unregulated hormones like this to help in their transition, which can cause all sorts of health problems. Many also have inflammation and infection related to silicone implants. Sex workers are less likely to seek medical care due to a number of reasons, including a fear of arrest, fear of having their children removed from their care, or the expectation that a provider will be judgmental. When they do seek care, many choose not to disclose the nature of their employment because they feel it's irrelevant to their care. As a result, their medical care providers do not fully understand their needs and cannot provide good care.